Hi, my name is Konika Schallen, and I'm a practicing physician in Jacksonville, Florida, with two aesthetic and laser clinics. And I also serve as medical director and senior vice president of clinical operations at Candela Medical. Well, we think of lasers often, and I think the lay public often thinks of lasers as cosmetic devices. And so I think what I hope that this study does is really bring to the forefront the importance of what lasers can do and how they can be used as a tool for something that's really beyond the visible. So it's great, we have better texture, we appear younger, our skin is appearing healthier, but it actually is healthier. And I think that that's important. I think that the study positions non-ablative fractional lasers not just as aesthetic tools, but as potential instruments of regenerative medicine and skin health. And one of the ways that we think about this is if you think about the GLP-1 analogy, semaglutide started as a diabetes drug, and then it became very popular as a weight loss drug. But now we're looking at other benefits like cardiovascular benefits, renal benefits, neurologic benefits. And in the same way, energy-based skin treatments could be on that same trajectory, doing far more biologically than we originally understood. Absolutely. I mean, I think that that's a great question, and that's where it becomes important to look at the type of laser. The red light therapies are also very helpful, but it depends on the power of the red light. It depends on the wavelengths that are used. It depends on how they're applied, the duration, the protocol, and so all of those, just like these larger lasers or medical device lasers, all of those details matter. And I think that some of the research that will begin to unfold is will help direct us to see what is the optimal way that we can utilize the tools that we have. Well, we're really excited at Candela to be leading the conversation in longevity as it relates to what EBD can do for skin longevity and skin health. We have active trials in progress, expanding upon this research, delving into some of the additional questions that have surfaced as a result of this data. How long can these changes last? What else can be done to prolong these changes or improve these changes in our skin? And we're looking into that as well. But we definitely need larger trials, more participants, longer follow-up to be able to further validate and extend the findings. And we definitely want the field to explore more of that correlation that we're seeing with the molecular changes that we're seeing on the epigenetic level to keratinocyte cancers more rigorously so that we can have the most optimized protocols to help prevent these types of skin cancers and help improve the quality of skin health in our patients worldwide. One of the things I think that I do want to add is really what's the patient's perspective on this data? When we explain the data to the patients, they are very excited. Many of them, of course, are fully on board with doing a treatment like this for cosmetic purposes. But what really excites patients is really showing how the impact is on their long-term skin health and long-term skin longevity. So I think that that is an important piece that I'd love to see physicians really understanding the data that's out there and speaking more to their patients about the possibilities of using this tool to help maintain their skin health.